welcome back to my channel. Today I am recording in my bed because I am pregnant and I want to be comfortable. So today's video is another pregnancy video, and this one is a little bit of a shocker because you may not know this, but I am having a home birth. With my daughter, I gave birth in a hospital with a midwife. It was a nice experience, and I'm glad I have that under my belt. But my dream, if I were to ever become pregnant a second time around, is to give birth at home. And there are many reasons why I wanted to, which goes back to the birth of my daughter. For starters, I just want to explain that home births isn't for everybody. In my case, my pregnancy is healthy, I'm healthy, my baby's healthy. I've done a lot of research on home birth, and it's exactly what I want in a birth, which I didn't get to experience with my daughter. So let me talk a little bit about the birth of my daughter. With my daughter, I had a midwife, and she was amazing. We developed a very close relationship. My midwife practiced out of a hospital, which means that she delivers in a hospital. So I was perfectly fine with that. I was quite happy with the midwifery care when it came to pregnancy. That being said, when it came to giving birth to my daughter, my contractions started on a Monday night, late at night, and it continued until Tuesday late at night. So I called my midwife and I told her my contractions were 2 to 3 minutes apart and they were really strong. So she advised me to go meet her at the hospital. And in the rush of and the excitement of going from my house to the hospital, my contractions stopped. Once I stepped foot in the hospital and I registered myself, my contractions stopped. No pain at all. And once you register in the hospital, they want you in and out of that room as quick as possible. So I went in because I was having contractions, and unfortunately they stopped because I was nervous. So what I did was I went up and down the stairs in the hospital, walking down the hallways, and my contractions didn't start. So my options were either to stay in the hospital and get Pitocin, which would start your labor pain unnaturally, not something that I wanted, or I was super tired, so they wanted to give me Demerol, which is a drug to relax you and put you to sleep. So my options were to give the hospital permission to start my labor through drugs, and that wasn't something that I wanted. 2, I discharge myself and go home and come back another day. And my third option was to have my waters broken. And to have your waters broken pushes the baby down. That immediately will start contractions or get things rolling. So after weighing out my options, I wanted to go home. So I sadly went home thinking that I was gonna come home with a baby in my hand, and I didn't. So I went home. My contractions were starting again because I was in the comfortable setting of my home. So I was just moving around, going in the shower, and just letting them get stronger and stronger. They didn't get strong to the point that I needed to call my midwife for a second time around until Thursday midnight. So I knew it was time. I called my midwife. I probably wasn't able to speak, but because I wasn't able to speak, that was already a hint to my midwife that it was time to go to the hospital. This time, from my house to the car, to the car to the hospital, I made sure that I concentrated on those contractions because I didn't want them to go away from the excitement or the fear that I had the first time. One of the things that I was super excited about my midwife and the hospital that she practiced in is that they had in-room birth pools, and I was super excited to experience that. That was something that I always wanted to try. But unfortunately, by the time I came into the hospital, they either knew that I came a second time around and didn't offer me a room with the birth tub, or the birth tubs were already taken, and once I got into a room, they couldn't transfer me to one that had one. So I was pretty bummed that I didn't have a room with a birth tub because that was something that I looked forward to with the birth of my daughter, and I didn't get that. But the room did have a shower, and I was able to get in it when the contractions were really strong. So since my midwife was delivering in this hospital, she was under rules and regulations of the hospital, and if they felt my labor was taking too long, they would pressure her to get things going. And that was something that I didn't like, and I did feel that air in the hospital, and I felt that from my midwife too. I also visually saw how hospitals operate when it comes to women giving labor, because being that I wanted to be mobile and walk around the hospital hallways, I heard conversations between the nurses and the OBGYNs there as to why this patient was taking so long. It's honestly a business. They want you in and out of the room as soon as possible so they can get somebody else in there. And when I was working around, there's like a whiteboard with a chart of names of the patients and what interventions they did to each of the mothers. And under my name, there was no interventions. Because I was so calm when I was laboring with my daughter, this was something of concern with the nurses and the other doctors, because they thought I wasn't progressing. They thought I wasn't even in labor. But when I did get attached to the fetal monitor, as annoying as that may be, because you have to stay still in the bed, and that's very uncomfortable, you can see how strong my contractions was. It's just, I'm not screaming at the top of my lungs. I practiced relaxation, so my labor went very well with her, but it wasn't fast enough for the hospital, which is my problem. So I got in like around 6, and around 11 o'clock my midwife says around 12 that she's gonna go because her shift is over. In my mind I freak out. I'm like, no, but who's gonna take my baby out? And I trust you. We developed this relationship all these months, and you're just gonna give it up to somebody else? And I didn't really like that too much, but I was determined for her to deliver my baby, and only her. So my options at that time was to allow her to break my water. I progressed so much in my labor at the time that she asked me. I allowed her to break my water, and that wasn't something that was part of my birth plan, but because I wanted her to deliver my baby, I allowed her to do it in order to speed up my labor. In my case, she came out very fast soon after they broke my water. So she broke my water, and when she broke my water, she noticed that the baby passed a bow in my belly, because the water came out with a yellow or green tint or whatever color it was. And in a hospital setting, when a baby passes a bowel movement in the belly, you have to bring in a neonatal neonatologist to take the baby immediately when you deliver it and check to see if they swallowed any meconium. On top of all these extra doctors that are going to be in the room now, she cannot perform something else that was very important in my birth plan, which was delayed cord clamping. And I'm going to do a separate video on why delayed cord clamping is important. But yeah, that was something that I didn't get to do with my daughter. So when the baby poops, hospital protocol is to cut the umbilical cord and put the baby on the little bassinet next to your bed, so that the team of neonatologists can examine the baby, make sure she didn't swallow any meconium and everything's okay. I knew that if the baby passes bowel in your belly, that it wasn't a high alert situation, and in hospital settings they do make it a high alert situation. And I was just like, whatever, at this point she's gonna be here any minute. So my labor went really fast. I jumped in the shower and I was in the zone, and she came out within 20 minutes of pushing, maybe less. She came out really fast. But I had a beautiful birth. So after they checked her out, she was fine. Of course I knew she was fine, because it happens quite often. The baby's coming down the birth canal, they're gonna get squeezed, and the contractions move the baby and squeeze the baby, so of course they're gonna poop. So it's normal for babies to poop in the belly. And they put her on my chest for like, I would say maybe 30 seconds, and then they put her on the bassinet so that the neonatologist can examine her, and of course she was fine. So I put her back on my chest, and I guess after an hour of bonding in the room for a little bit, you get transferred to the recovery room, which is the room that all the visitors come in, and you unpack your things and you shower. And in transition from the labor and delivery room, my husband goes with the baby to the nursery to get her washed and changed and cleaned, and I stay all alone in that room all by myself waiting to get transferred. And then for me, that was such a sad moment, just being alone there looking down at my empty belly and not seeing my baby there after 9 months. That was such a sad moment, and I was all alone waiting to get wheeled to my new room. So I make it to my room and I don't see my baby anywhere. I don't see my husband anywhere. I don't see anybody I know, and I'm freaking out, and I'm so sad, just waiting for my baby to come. I waited at least a good hour until she came, and then I hear a knock on my door, and it's my mom. She was with me when I was giving birth, but I'm just like, what are you doing here? Where's my baby? Find my baby. And she's like, I don't know where your baby is, because she didn't go with her to the nursery. My husband did, and I have no idea how to get to the nursery, but I just stay put in my room, and just very sadly I wait until my husband comes rolling in with the baby an hour later. So I had a hospital birth with my daughter, and this time around I wanted to fulfill my dream to have a home birth with my second pregnancy if I were to become pregnant, and I am. So I am fulfilling my dream of experiencing a home birth. I don't judge anyone on what type of birth they have, whether they have it at home or in the hospital, and I also don't want to be judged, because in both scenarios you have to do your research, and at the end of the day all that matters is the results at the end, in which you hold your pretty little baby in your arms. So going back to what I said about doing your research, whether you're having a hospital birth or a home birth, you want to research the OBGYN and the midwife. Make sure the doctor and the midwife has a good reputation, and make sure they respect your birth plan, because that's something that's very important to you, and it should be important because you don't want any complications with your health or the baby's health. And you want to research the hospital, make sure that they're clean, they have a good reputation. When it comes to home birth, I also did my research. I made sure that the midwife that I chose has a very good reputation, is very experienced, and she goes along with my beliefs behind having a home birth. For example, when I was pregnant with my daughter, I toured a hospital that had a policy that you weren't allowed to eat or drink during labor, and the reason behind that is just in case you have to do an emergency C-section on you, they don't want you to have a full stomach. That same hospital has a mandatory policy to receive an IV and keep that IV until you give birth, and that was something that I didn't want. And if you didn't want it, you have to choose another midwife or OBGYN that practice at a different hospital, because X hospital has this rule that you must have an IV during the beginning and end of your labor. So with every scenario, whether you want to give birth at home or in a hospital, you have to do your research. So the midwife that I chose is very experienced. She actually spent many years practicing out of a hospital delivering babies, and she also delivered in birth centers, and now she's in a point in her life in which she wants to dedicate herself to home births. And interestingly, the difference between the midwife that I'm having now and the midwife that I had with my daughter, there is no difference, because they both have the same certification. They're both certified nurse midwives, except one practiced out of a hospital and took your baby out in the hospital, and the other is now practicing taking your baby out in the comfort of your own home. So with my daughter, the adrenaline and the rush and the fear of getting ready and packing up my things, that stopped my contractions, and the hospital was only 20 minutes away. So within 20 minutes of my contractions being 2 to 3 minutes apart, just like the textbook says, go to the hospital, they stopped. So going over my reasons for having a home birth, it is less stressful. My contractions will be continuous. My contractions won't stop because of the change of environment or people coming in and out of your room. I'm just going to be at the comfort of my own home. I am going to have my own birth pool. I'm not going to share it with anyone else. I don't have to wait till the person that's laboring in front of me to finish so I can use it, or whatever the case may be. It's my birth pool. I can use it whenever I want, and you don't have the pressure of giving up your room for the next person, because that's what they do in the hospital. They want to get you in and out of the room as quick as possible so that they can keep the business going. At the comfort of my own home, I won't be pressured to leave because someone else is coming and somebody else needs a room, someone else needs a bed, someone else needs my pool. No, this is all my stuff. This is all the stuff that I'm used to, that I'm comfortable with. So the most saddest moment in my labor with my daughter was when I was in my room and I was looking through the hallways, couldn't find my baby. I had no idea how to get to the nursery. At the same time, I was still weak, I was still recovering, and I wasn't going to pace around and run around the hallways trying to find my baby, my husband in the nursery. I just sat on my bed patiently and very sad and just waited till my husband came with my baby. That being said, I can have my baby immediately and forever on my chest, however long as I want, in my house. Nobody has to take him away from me. In a hospital, you have like your whole crew waiting for you in the waiting room, waiting to see you and the baby. And I delivered my daughter around, well, I was in my room like around 3, so from 3 to 9 I had visitors coming and to visit me. And as much as I love you guys, I was so tired, and at the same time you're passing your baby around and chit-chatting and entertaining, but you're tired. And the best time was at 9 o'clock when visiting hours were over, and it was finally just the 3 of us. It was like, wow, we just did this day, we just had a baby. And that's when like realization kicks in. So depending at what time you give birth in a hospital, you're gonna have a lot of visitors, and at the comfort of my own home, I can let people know when it's okay to come and visit me, and I can rest and relax and eat, and I have control over who comes in and out of my house when I feel rested and recuperated. I didn't sleep in 5 days. That was really tough, and there was just no private bonding within the 3 of us. So now with a home birth, it's gonna be just us bonding with the baby on the bed, and it's gonna be amazing. Another reason why I want to have a home birth is because I'm a little bit of a germaphobe, and I don't like hospitals. When people are hospitalized, I'm like always seeking like the next hand sanitizing booth, and I'm pumping it and like rubbing it and putting it all over myself. So I'm a germaphobe, and I feel comfortable in my own house with my own germs. These germs that are around me and the air and the environment is something that my body and my baby is immune to. So in a hospital setting, there's a lot of germs, there's a lot of sick people. I don't know if that person has new gloves. I don't know if the room was clean enough to protect me and my baby from germs. So that's why I want to have a home birth, because I use natural ingredients for cleaning, and the cleanliness in my house is something that I'm comfortable with giving birth. And in a hospital setting, I am not sure if you wash your hands, I'm not sure if you change your gloves, I'm not sure if the patient next to me threw up and you're still carrying those germs on your uniform. So I feel more protected in my house with my germs, and that's something that's very comfortable for me. Another reason why I am having a home birth is because there is no interventions. There's no C-section, no synthetic drugs like Pitocin, no anesthesiologist knocking on your door ready to give you an epidural. I don't have to lay in bed for hours. The fetal monitor that my midwife has is a Doppler, which is the little joystick attached to the little beeper thing, and she just checks whenever she feels like she needs to check, and I'm still able to move around and move freely. I'm able to eat and drink whatever I want. In a separate video, I'm going to do a what's in my birth kit video, which has a whole bunch of medical supplies and supplies for me and the baby. My midwife is very equipped. She has her own medical supply kit with IVs, with the surgical scissors, and she also has emergency drugs just in case you hemorrhage. So she's very equipped, and she has all those things in her birth kit for the benefit of the birth. She also develops an emergency plan for transfer, in which we decide on the nearest hospital to take me just in case me or the baby has any complications or anything that we need to get treated and taken by ambulance. God forbid that happens, but we do have that plan in place in order to, be safe. So for me, home birth is a professional occasion in a relaxed environment. I'm comfortable with doing this, and I'm super excited. I can't wait to share with you guys the beautiful experience when I have my baby. So I'm super excited, and please watch any of my other pregnancy videos. Don't forget to subscribe to keep up with my other YouTube videos, and until next time, bye guys.